Good morning. Very pleased to have present in her office here in Southern California, Dr. Heather Roberts. Thank you for having us, Doctor.
Thank you for having me.
And she's active in the USC Keck School of Medicine and as well as UCLA while maintaining obviously a very, very busy clinical practice. She's nearly a decade or so since 2013 with InMode.
2013, yes.
And she's probably the most experienced clinician with the IPL technology developed by Mishka Krendel, the CTO of InMode. And she has tons of experience. And
Great. Thank you so much for inviting me, Dr. Chia, and thank you to InMode. So today we're going to talk with Christine, a busy working mom, physician, and mother of three, who's looking to freshen her skin. So we're going to just talk a little bit about what she's hoping to achieve with the Lumecca photofacial rejuvenation procedure. How are you doing today, Christine?
Great, thank you for asking.
Nice to see you. So tell me what you're hoping to achieve and what you want to address today with Lumecca.
Well, over the last year, I think all of us have been under a lot of stress, and I've been spending more time outdoors as well with my children. And I feel like I've really accumulated a lot of pigmentation, especially in the cheek area, my temples. You know, the texture of my skin isn't glowing.
Okay.
I would love to feel refreshed, still like myself, but you know, a more healthy looking complexion.
Great, perfect. And you've never had any laser procedures before?
I've never had an IPL, no.
Okay, all right, wonderful. And so when you go out in the sun, tell me what happens with your skin. Will you burn and then tan, or do you always burn? Tell me what your skin is like.
I'll definitely burn if I'm not wearing sunscreen.
Okay.
And then it will turn into a tan probably for a few days. But yes, I burn first.
You do, okay. And I'm sure you're always wearing a hat and sunscreen when you're out.
Yeah.
And so with your children, how much sun exposure, like just so I know in terms of my settings and how aggressively and non-aggressively to go, what do you have coming up in the next month or so for outdoor plans or trips?
Well, usually I'm outdoors on the weekends for a few hours, but it's, you know, protected, of course. I don't have any big trips coming up in the summer, maybe
Great.
not until July.
Okay, fantastic. And are you on any medication right now?
No, I'm not.
Okay, any allergies to anesthesia or any medication?
No, not that I know of.
Okay, perfect. And then have you ever been on any immune suppressing medications or Accutane?
I did take Accutane one round in my 20s.
Okay, all right, nothing recently?
No.
Okay, perfect. And no other medical issues, sensitivity to the sun, thyroid problems, diabetes?
No.
Any problems with healing or scarring? No?
Thankfully, no.
Okay, and when you were pregnant, did you ever get melasma or the mask of pregnancy?
No, I think my freckles got a little bit darker,
Okay.
but that faded after about 6 months.
Okay, perfect.
Yeah.
And nobody in your family that's had melasma?
No.
Okay, wonderful. All right, do you have any questions for me?
I was just wondering what kind of downtime I can expect.
Okay, sure. So basically, before you leave today, after we get done with the treatment, you're going to see your brown spots are already turning a little bit darker. That's my endpoint.
Okay.
And so I always say they look like little baked-in coffee grains. It's not going to feel so much like crusting and peeling as much as just feel like it's baked into the skin. And so with all the aftercare that I'm going to give you, you know, you're just going to do the gentle aftercare. Don't pick or scratch them off. Typically, they will fall off within 5 to 7 days.
Okay.
And you can cover it with makeup as early as tonight if you needed to.
Okay.
All
And
right.
then how many treatments do you think I'm going to need, and when could I come in for my second one if I
Right,
wanted to?
right. Great question.
Yeah.
So, you know, typically, again, with the first treatment, you're going to see at least a 90+% improvement in your brown spots. Sometimes, you know, if there's a couple little brown spots that remain, we'll do a follow-up second treatment in 4 weeks. Blood vessels and redness are a little bit different. So because they're really more like living, breathing structures, they often can take anywhere from 3 to 4 treatments, sometimes 5, depending on the patient. But I mean, you have beautiful skin. So looking at your skin, I mean, probably 1 or 2 is going to be plenty. And then maintenance, like, you know, you're going to continue to do all your good skincare and sun protection, and it might be something that once or twice a year you want, again, freshen things up, because it does give a really nice glow to the skin as well. It'll make light reflect off your skin in a much healthier way. and even maybe a little pore tightening. A lot of patients will notice a little bit of collagen stimulation, so the skin feels a little bit smoother and the pores can look a little bit tighter. But yeah, this is my favorite procedure. I mean, patients really, it's like, it's very predictable and patients are very happy with results.
Great.
Yeah, great. Let's get started.
Okay.
And so we want to treat the skin delicately, no chemical peels, microdermabrasion, retinol products, Retin-A, tazarotene, anything that would be excessively exfoliating. Some patients, if they're getting, a little bit antsy about how soon the brown spots will come off, after maybe 3 to 4 days, I will let them use like a Clarisonic device or some other like ultrasound rotating brush if they want to. But, for Christine, I mean, she'll be fine with just a gentle cleanser and the elastin twice a day for the next 3 weeks, and then some chemical-free sunscreen. So we're going to use a little tinted chemical-free sunscreen on her before she goes. And the reason that I really like the chemical-free sunscreen is, to avoid any potential irritation from, the chemicals that are in chemical-based sunscreens. And, we're learning more and more about the effects of visible light and near-infrared and blue screens and computer light on pigmentation in skin types 4 or darker, even some 3s, and worsening of melasma, whereas in lighter skin tone, type 1 and 2, that visible light can cause more redness and worsening of rosacea. So if you think about what we're trying to achieve with the IPL, we're trying to fix pigmentation and we're trying to fix redness and rosacea. So again, that's why I like a tinted sunscreen. And so if the sunscreen is visible, meaning it has the iron tint, then it will block visible light. Just a white sunscreen won't. If patients don't want to wear a tinted sunscreen, then I'll at least have them do a chemical-free, non-tinted sunscreen with maybe a little dusting powder with some iron pigment in it. But yeah, so this is great. I mean, she can go out tonight. She doesn't look like she's, had anything done that's scary. She can go home to her kids and enjoy her weekend. All right, well, thank you so much, Christine.
Thank you.
Great. All right, so we're going to get started with lovely Dr. Christine, and we just washed her face, and so now we're just going to prep her skin, and I like to do a really nice prep as long as the patient's skin is not too sensitive, with typically like a combination of alcohol, some Hyclodex spray, which is hypochlorous acid, and even sometimes I'll mix in a little Zephyrin as well. I am noticing, Christine, that I didn't realize that you had a little microblading on your brows, right? Okay, so really important to, screen for any lip tattoos, any other cosmetic tattoos. I mean, you would avoid the hair-bearing area anyway because we don't want to, singe the hair or cause some patchy hair loss that could be permanent. So we're going to stay away from the brows, but especially knowing that they have a little bit of a tattoo, I'm going to definitely stay away from the tattoo at the edge of her brows as well. So I'm going to go ahead and just start cleaning up her skin. And we try to have patients come in with just their sunscreen and not a lot of heavy makeup and no mascara when possible, so the mascara doesn't flake down into the gel and then you have to stop and clean up and restart. But often patients do come in from work, and so they may have on makeup as well as sunscreen. So always be really good about cleaning and prepping the skin. There has been some studies showing that even with non-ablative lasers, you can get a staph infection. Some people do harbor staph around their nose, and if people are not, cleaning their makeup brushes so well, but, definitely you'd want all the makeup and sunscreen off of the skin so you don't have any tint, competing pigment, anything to irritate the skin or spark the skin, if because a lot of the sunscreens have iron and titanium and zinc in them. So I just, do several passes until I'm seeing a nice clean area. And she's got great skin, so I don't have to do a lot of cleaning. So when we treat men, one of the things that I always ask about is whether they, like to have a close shave all the time, or if they do like to be able to grow some facial hair. because again, since, you know, this laser has overlap in, you know, pigment is the chromophore that we're looking for, the brown pigment, and, you know, as well as red, but hair has brown pigment in it as well. So if a guy, you know, comes in and he's like, no, I always have a clean shave, or I don't care if I get some patchy hair loss, it'd be great getting rid of some of that hair, then I will treat the whole face. I'll always have them shave the morning of, and if they come in and there's even a little bit of stubble, I'll shave them again before I start, just so I don't singe the hair onto the skin. But for a lot of men, it's really nose, cheeks, and upper forehead, and that way they can decide what they want to do with their hair pattern down the road. So I'm going to put her goggles on. So everybody, you know, always have protective eyewear. So I'm going to put little laser goggles on her. Christine, go ahead and just hold those on your eyes for a minute, and I'm going to adjust the button. And I'm going to slide it down so I don't poke you in the back. Is that okay? Mm-hmm. Not too tight?
Nope.
Okay, perfect. And then I'm going to put my goggles on as well. So in terms of her settings, so from what Christine has told me, when she goes out in the sun, she's, you know, a type 3 skin type. And so, you know, again, with Asian skin tone, there's a big range. So, you know, some Asians have very light skin, medium to darker skin, and even sometimes in a lighter skin Asian patient, you know, they still have propensity for hyperpigmentation or melasma. So I'm always super conservative, especially the first time I'm treating someone. So we're actually going to start with a longer wavelength filter. So that's the 580 nanometer handpiece. So, you know, when we talk about, you know, how to select which handpiece, first thing is you assess the patient's skin type. So if they're a type, you know, 1 or 2, and they don't have any propensity for melasma, then I will definitely use the 515, which is the shorter wavelength. A type 3 Asian type or Latina skin, I'm going to probably start with a 580 nanometer, see how they respond, because melasma is really one of those really tricky things, because, you know, heating the skin can actually make melasma worse. And so even though initially the patient's going to love you because it's going to brighten up immediately, then as it comes back, and if it comes back darker, they're really going to be upset. And so, so for that reason, I think with the first treatment, it's always best to be really conservative. So we're going to put a refrigerated clear ultrasound gel on the skin, and that's for both to protect the epidermis as well as to give her some additional cooling comfort and to make a really nice connection between the sapphire crystal on the tip. And so this is, you know, more of a contact crystal cryogen cooling. Some of the lasers, you know, have more of a liquid nitrogen spray. For cryogen, this is a contact between the sapphire crystal and the gel. And so the nice thing with the Lumecca device, go ahead and just turn this way, Christine, is that, you know, the spot size is 1 centimeter by 3 centimeters. So you get this really nice, you know, 3 centimeter square area that we're going to march across her entire face. So we'll get a nice full face treatment without any gaps or, you know, any skip areas. And depending on how her skin's reacting, you know, I typically will do 2 passes. And the first pass, I'll go, you know, in one direction. And then with the second pass, I'll go perpendicular 90 degrees. And that way, again, we don't get a chance of any footprinting or missing any areas. In terms of how much gel to put on, I mean, you don't need to do a ton. Sometimes if there are areas, like in the temples, if someone doesn't have a lot of volume in that area and it's, you know, a little bit hollow, I might put a little bit more in that area just so that the sapphire tip, you know, makes really good even contact. But, you know, just enough gel so there's a, you know, a nice glide between pulses. Okay. All right, so we're going to start with a 580 nanometer handpiece, and then the next thing we have to decide is how strong a setting to do. And so I like to always look at how the skin is reacting. So I'll start with one number and then I go up on the setting based on what kind of reaction I'm seeing. And the endpoint I'm looking for is really just a little bit of almost like a graying or darkening of the brown spots, and then, you know, sometimes a little contraction or blue